companions and animal companions and individuals experiencing homelessness. So if you are here for that training, you are in the right place. We're going to spend some time talking about best practices and just better avenues to support individuals who might have pets. So we're going to talk about a little bit of logistics and controls, and hopefully we're all familiar with this. At this point, we live on Zoom a lot, but the Zoom controls, so if you are not talking, if you can just make sure you mute yourself, and you're able to start and stop video there. It's a smaller group. We would love to see your faces. It's really sad to talk to tiny black boxes sometimes. So we encourage you, if you're in a place and comfortable doing that, to definitely come off camera. And so we just wanted to give me just a second. So I want to make sure you guys can see. I said there are tiny black boxes over the screen. Can you guys see the PowerPoint okay, or are there kind of issues with it right now?
It looks like, oh, never mind.
I can see it.
I
Okay.
can see it, yeah, but they kind of pop in and pop out.
Oh.
By any chance, are you getting notifications or something that you kind of, okay, then I don't know.
No. So let me know if anything we can shift and pivot. Want to make sure you can see the screen, but you obviously, some people know how to use the chat box, so we'll encourage you to use the chat. It's a smaller group, so we also would love to hear from people. We'll have some interactive portions and question and answer, so we would love for you to come off. And we will go from there. So we'll ask questions and have you react. So there's the little react emoji at the bottom, and we will get started. So hopefully, we wanted to talk a little bit about the learning objectives today. So we'll spend some time talking about the benefits of pets and emotional support animals for individuals experiencing homelessness. And we'll spend some time talking about the different terms around pets, emotional support animals, and service animals, because that will be important for some of the legal definitions and some of the services and supports that might be available. And then we'll spend some time talking about additional barriers that individuals experiencing homelessness with emotional support animals or pets face, and talk through some strategies to overcome some of those barriers, as well as opportunities to advocate for pets and ESAs within the homelessness and housing system. And we'll end with some review of policy and examples of programs that are throughout the United States to support animals and ESA owners. And so just walking through the agenda very quickly, we'll do some welcome and introduction icebreakers, spend some time just level setting around recovery-oriented care and wellness and talking about the animal impact on wellness, and then talk a little bit specific to individuals experiencing homelessness and evidence that for service animals and ESAs and kind of the benefits for individuals experiencing homelessness. And we'll spend some time talking through legal definitions. Won't be the most fun, but I think it's really important for knowing kind of what is out there, doing a little bit of myth busting, and then we'll talk a little bit about overcoming barriers, and then some of the innovative practices and policies. And we wanted to leave ample time for questions and wrap up. We know that this is something you all are seeing, and we'll want to make sure this is as helpful and interactive as possible. And so as we get started, just a high-level introduction for those who haven't been to any of our trainings before. We are the Technical Assistance Collaborative, or TAC, which is a nonprofit organization that's dedicated to helping the nation's human services, healthcare, homelessness, and affordable housing systems look at implementing policies and practices to really empower individuals to live healthy and independent lives in the communities that they choose. So we do a variety of TA and consulting and training all around those particular areas. So getting a little bit further into introductions, I'm Jordan Gully. I'm a licensed clinical social worker and a senior consultant with TAC, and have about 20 years of experience in both the homelessness and housing sector, as well as the behavioral health sector. And kind of my experience has really been in the overlap of the two. And so prior to coming to TAC, I was overseeing the crisis response arm in Washington, D.C. But before that was kind of overseeing street outreach and permanent supportive housing for Pathways to Housing, and have this is a particular area of passion for mine. And so I will let Teresa also introduce herself.
Hi, I'm Teresa Young. I'm a senior associate at TAC. I also have about 14 years of experience in kind of like the overlap of homelessness, harm reduction, housing, and substance use. And I think I'll stick a little bit to kind of what's relevant in my experience for today. And that is that in my previous role before coming to TAC, I operated several shelters, and 3 of those shelters allowed a variety of different like animals. So some accommodated service animals, some we were just like pets, any pet that you have, we would try to accommodate. And at one shelter, we actually had a therapy animal. So I'll probably be bringing some of that into our discussion today, just kind of to talk about like what the possibilities are. Now I'll pass it back to Jordan, and I'm happy to be with you all today.
Thanks so much, Teresa. So, sorry, I'm having little stick issues. So just to do an icebreaker, and feel free to drop this in the chat, we want to know who's in the room with us. And we realize these are a lot of questions to answer in chat, so feel free to kind of pick one of your favorites and answer, but we're interested in knowing kind of name, pronoun, role, and if you have or have had a pet, what kind, and what benefits do your pets have in your life. And so while people are dropping that in the chat, I can go to our next slide. So both Teresa and I are big pet fans. And I'll let Teresa talk about this in a minute, because these are actually her pets. I didn't put my pictures up here, but I have 2 pets, one of which is right beside me right now as my constant coworker. And when I oversaw the largest street outreach provider in DC, my pet would often come to work with me. Kuma, he's a lab basset hound mix that looks like you put a lab in the microwave and shrunk his little paws down, so he has tiny little legs. And my team would actually take him out on outreach, and he kind of ended up being a pseudo outreach worker slash therapy pet for a lot of the individuals that, we found a lot of the people that maybe we had difficulty engaging were really willing to kind of come up and engage and wanted to pet him and cuddle with him. And so he kind of became a pseudo team member on our team. And my team loved it because they could take the dog out. He loved it because he got a bunch of exercise. And then the individuals we were serving loved it because they got, some time to bond with animals, and they would tell us stories about, their pets from childhood and what it looked like. So I think he kind of became a pseudo tool for engagement and rapport building. And Teresa, I can let you talk about your pets while people are still dropping some introductions into the chat.
Sure. So as you can see there, that's my daughter with my 2 pets. One's a Shepherd Lab mix, and didn't really come on outreach or anything with me because she's got like that very high energy. But the other one, the black and white one named Zuzu, similarly, I brought to services with me. And I think the reason I thought, aside from it being the icebreaker, and we're participating in that too, is to kind of point out like the many benefits that pets have. And we'll get way more in depth in this later in the training. But my daughter is an only child, and she finds great companionship and company within the pets. And like I said, I would bring Zuzu, especially to our women's shelter that I used to operate. And it would really make a difference in the shelter in terms of people's mood. People would plan around minimizing their use if they could take the dog for a quick walk around the property. So again, like we'll get into kind of the evidence that demonstrates what Jordan and I saw when we were out in the community with our pets, and just the positive impact that they really can have on people who are not having the best time in their lives. No one wants to be in a homeless shelter. And I think being able to have animals, pets, that comfort makes it just a little bit lighter. So just one of the many things that we've noticed.
And I just see in the chat lots of love for pets. People saying they taught them patience, and we're really going to spend some time talking about the benefits of pet ownership and really that animal human bond before we get started. I think it's important to talk about kind of the whole picture, and so wanted to start with recovery oriented care. So we utilize most often the SAMHSA definition, and there's a reason for that. I really like the dimensions that they look at and that more holistic picture of recovery, and not only recovery but wellness. And so they define recovery as the process of change through which individuals improve their lives, wellness, and live self-directed lives to strive to reach their full potential. And so when thinking about recovery-oriented practice or recovery-oriented engagement, obviously you're engaging individuals that maybe have lots of vulnerabilities, maybe some behavioral health conditions, maybe lots of trauma. And so recovery is not just related to behavioral health. It can be related to trauma. It can be related to, so we're thinking of recovery really from a holistic perspective. And part of why we use SAMHSA's definition is that they classify this into 4 major dimensions of recovery. And what we're really talking about today, which will be tied to the human-animal bond, is that holistic view of wellness. And so I think this breakdown really helps present a more holistic view of what wellness and recovery look like. And so the 4 dimensions, the first of which is health. And so overcoming and managing one's disease or symptoms. But really that can include physical health, it can include emotional health, it can include psychological health, behavioral health. So thinking of health and what does it mean to really have wellness and be healthy. And their stance on it is really, it's the ability to make informed, healthy choices that support all of those different avenues of health and wellness. So emotional, physical, psychological. And so when we get to talking about the animal-human bond, you're going to see a lot of aspects that animals bring to promote health from this perspective. The second dimension, which is very pertinent to what we're talking about today, is home. And so a component of recovery and a dimension of recovery is having a safe and stable place to live. And we all know the multitude of factors that come into play when you don't have somewhere where you feel safe, secure, even a shelter over your head at night. Lots of people are often on high alert, feel like they need to keep themselves safe, and that in and of itself can promote things that are counterintuitive to health and wellness. And so really think the component of home and safety is a huge part of recovery and wellness. And the third aspect that take into consideration when you think about wellness and health and recovery is purpose. And so engaging in meaningful daily activities, I think this is something, I work as a clinician on the side, and I think a lot of the struggles that happen is people trying to find purpose, trying to find their place, maybe trying to find purpose after a traumatic event or after getting into housing. Like, what do I do now? What do I want my life to look like? And a lot of it's tied to purpose and meaning. And so when thinking of wellness and thinking of recovery, making sure that people have something that gives them purpose, whether it's volunteering, a job, a school, sometimes it's caring for someone else. Often when we hear, particularly, on outreach, I would hear, my purpose is making sure my dog's okay. And like, I would have people go and seek primary care treatment just because they're like, I want to be here to take care of my dog. That's my motivation to do some of this. And so I think, animals, we'll talk a little bit about this in a few slides, but I think sometimes animals help with purpose. And so thinking of, we always start with kind of level setting around recovery and recovery oriented care, because often when people hear recovery, maybe if you're thinking of it from a behavioral health lens, you'll think of connection to behavioral health services. Or if you're thinking it from a housing lens, you think of it as, we'll connect to housing resources. But I think that holistic picture, that's health, housing, purpose, and the last part is community. I think, all of us want to feel part of a community, a sense of belonging. And community is really about relationships and social networks, support and love. So a sense of community, feeling that as you belong to something that's greater than yourself. So we tend to talk of recovery oriented care from these 4 different domains, but I think when we're thinking about engaging individuals, either on street outreach or in rapid rehousing or in PSH, engaging them from a wellness lens, which is looking at all the different domains that make somebody feel well and feel healthy and feel all of the different things. And so I really like these visuals because it's not just health or housing, it's all the different aspects that make wellness. And so it could be work, it could be community, it might be relationships, and at various parts in our lives, maybe some of these circles get a little bit bigger. There's been times when work took up way more of the circle than I wanted it to. And so the intervention or strategy there was, all right, how do I make it so the circle's a little bit smaller and I can focus more on family, or I can focus more on relationships? And really, even in engaging individuals, we're looking at, what's most important to you, what helps promote your wellness. Right now, my focus is on education, or maybe it's on repairing relationships. And so that holistic view of engagement and how we engage people from a wellness lens of not just focusing on housing or behavioral health or, employment, but thinking of all the other aspects that make people feel well and healthy. And so, as I alluded to earlier, we're going to talk a little bit about the animal-human bond and how that impacts wellness and recovery. And so the animal-human bond is actually a term that was coined by American Veterinary Medical Association, and it defines it as a mutually beneficial and dynamic relationship between people and animals that's influenced by behaviors essentially essential to health and well-being of both. So it's mutually beneficial. The bond is beneficial to both mental, physical, and social health of people and animals, and overall plays an important role in human, animal, and community health and welfare. And so as people were dropping in the chat, kind of talking about the animals' impact on their patients and their happiness, and so I think we're already starting to see some of that in the conversation that's bubbling up, but wanted to spend some time talking through what those benefits are. Let's see if I can get. And so looking at the impact of the animal-human bond on wellness and recovery, and we kind of broke this out into the different domains related to recovery. So there are so many impacts, and there's extensive research on that animal-human bond and the promotion of health and wellness and how it helps. And so looking at the health category, there's improved cardiovascular health and lower triglycerides, overall longer life expectancy and lower blood pressure. So they found that individuals who have pets and have a bond with an animal see positive health impacts related to cardiovascular and longer life. They've also seen that individuals that have pets and have that bond with an animal have improved social connection and social support. There's decreased isolation and increased community integration. And you think of, maybe the individual has a dog and they're taking the dog out to the park, and that's how they engage with their neighbors. Or, when you're walking down the street and you have a cute dog, people are always like, oh, can I pet your dog? So it's just that increasing sense of connection. There's an individual that we moved with that I worked with that moved into housing. And on her first night, she was like, this was the loneliest night I've ever had in my entire life, was living in an apartment on her own for the first time. And so within a week, we had worked to get her a cat because she had a cat growing up and she had such a connection to it. And so immediately talked about the impact of decreasing loneliness, and she felt less alone. And in this big house, she had someone else there with her that she could talk to and pet. And so I think, anecdotally we see this, but there's definitely lots of evidence that supports the enhancement of wellness and recovery through pets and through animal-human bond. The other thing that they've seen kind of on an individual level is reduced rates of depression and anxiety and enhanced coping skills. And then when you think about it on a holistic level, they've also seen that pet owners have saved an estimated 2.2 or $22.5 billion in healthcare costs. And so kind of the healthcare savings, which I think when we talked about recovery-oriented care and that global view of wellness, I think that makes sense given all of the impacts and benefits that have been studied and found for individuals that have animals and are connected to animals. And so I'm going to play a video and we'll spend some time talking about it, but just the experience of human animal homelessness. So let me know if you have any trouble hearing it.
My name is Judy. I live in West LA, under a bridge, in a tent. This is my lovely fiance, Christopher. This is Anastasia. This is Melody, and this is Roxy. I became homeless when I was 16 because my mom was in an abusive relationship, and I couldn't take it no more. I got Melody through a newspaper. The couple fought pit bulls for a living. I saved her when she was 6 weeks old, and I had her ever since then. So she acts like a big baby. Anastasia, I picked her up from a lady that didn't want her, and she said to come get her or I'm gonna put her out on the streets. And I got her for free. The gentleman that had Roxy, he didn't want her because she was blind. And I felt like every animal, blind, handicapped, disabled, or whatever, deserved a life. And 4 days later, I took her to the vet and found out she's born blind. No matter what, I still love her. If I didn't have them, I don't know where I could be right now. Anastasia and Melody are both service animals. Anastasia is my service animal because she lets me know when someone's coming too close. Sometimes she could tell when I'm having a panic attack. Melody, she naturally could tell when I have a panic attack, and when I have one, or when I'm getting ready to have one, she lays next to me. If they lick my face, I'll wake up and I'll realize what's going on. If they don't, sometimes I'll just have one and I'll be in my own world for a good 5 minutes to an hour. Anywhere downtown, I didn't have no services. They always denied me. They said my mental disability wasn't what they're looking for. And I believe that physical or mentally is still a disability. To make it easier for people that have animals, they gotta understand an animal is just like a child. I do have a plan to get Section 8, and I do have an apartment coming up. Anastasia and Melody are both allowed to come with me because they're service animals. Roxy, I'm gonna talk to the lady and see if she could come. If not, I'm gonna sneak her in. People say, if you live on the streets, why you have a dog? You can't even take care of yourself. But it's kind of funny to me because a lot of the vets trip out because they're healthy, being on the streets, and they're always taken care of. When I have them, I'm a better person. And when I didn't have no animals, I didn't have to worry about nothing, no responsibilities. And I didn't like that. I like to care about things. I'm 5 months pregnant, and it's gonna hurt to go back home to deliver the baby. I really don't want to leave them behind, but I have to. I'll be staying at my mother's house for a little bit. Whenever my fiance gets an apartment or something, then I'll be coming back up here with the baby. I don't want to bring a child to the streets because I know if I bring a child to the streets, CPS will get custody of it. I just want to own a big house one day and just rescue all these animals that's loose and been abused and have a bad past.
And so just wanted to see, and that's a smaller group, so feel free. I see Melissa put in the chat, here come the tears, 100%. Feel free, it's a smaller group, to come off mute, but just curious if there are any reactions to the video or some of the things we've talked about already.
Yeah, I can talk a little bit. I've seen this a lot, like with my clients, and a lot of them have service animals, and just like the really strong bond that they feel with their animals is like very apparent. And I was speaking with a client recently, just talking about how intuitive, like particularly dogs are, to when you are like feeling anxious or sad, or like there's a dip in like emotion. And so having like animals pick up on that and then being able to like react and support in that way, it has been like really valuable for them. And I know I've experienced that too, just like with my own pets. They sometimes like somehow always can tell when like something is wrong. And so yeah, just wanted to like comment on that.
No, I really appreciate you sharing. And I think that like anyone that owns a pet is like 100%. You see all this nodding and like thumbs up happening, but it's so hard to quantify. So is that captured in the studies? No, but the intuitive nature of, an animal knowing what's happening and offering that support and just comforting during those situations, I think 100%. Any other reactions or kind of things that you're seeing in individuals you're working with?
I just noticed the purpose, the sense of purpose and responsibility and routine that they can give to people. So that can help on so many levels because our clients need purpose. They need a reason to get up in the morning and all of that. So yeah.
Yeah, 100%. I think that's and part of why we start with that recovery oriented framing is all these like categories that I'm like, animals help with all of these. And so I think that the sense of purpose is a huge thing that lots of people struggle with. And I think it definitely came across in that video, 100%. Wow. So Mandy put in the chat, we have a person whose dog recently protected her / prevented sexual assault. She talks about being bonded to her dog for this and many other reasons. 100%. We haven't even talked about the protection factor, particularly if you're unsheltered or living on the streets. I think, 100%. I know my dog would attack if somebody was threatening me, and so the sense of protection, particularly when you don't feel protected at all because you're in a very vulnerable position. Any other thoughts? I think these are all great and part of why this human animal bond is studied so extensively. And so thinking about, we've talked a little bit about this, and we did like that broader vision of how animals support individuals. And I think through the chat and through that video, we've seen more around pet ownership for people who might be living unsheltered. And so honing in kind of on individuals experiencing homelessness or unsheltered individuals. Based on CFC data, it's estimated that 10% of people experiencing homelessness own pets. Emotional support animals are service animals. And really that estimate is 10 to 25%. It's very, the way we all know the way that data is collected is sometimes misses individuals. And so, that estimate's from 10 to 25% of individuals. And people who own pets have longer periods of homelessness and are often living unsheltered. And we'll talk a little bit about some of the barriers and what might be perpetuating some of that. And then also some strategies that have been utilized to further support individuals experiencing unsheltered homelessness. But really honing in on other ways that pets benefit people who are unsheltered. Some of these mirror that broader study. These are, these studies are specific for people experiencing homelessness, which is obviously less studied than that broad expansive research on the animal-human bond, but similar things have been found to what was put in the chat, as well as what we've talked about before, which is a reduction in depressive symptoms, that they provide a sense of responsibility and a reason to live. So somebody was talking about the purpose that they saw in that video. So giving someone a reason to live, reason to reduce substance use, or even seek healthcare. And earlier I talked about the individual I worked with that was like, I'm going to go get this looked at because I want to be here for my dog. And that was the motivation to seek healthcare. And that pets are linked to greater social support and capital and community integration and physical activity, which, that community integration piece is so linked to purpose as well and meaning. And then also just the opportunity to give and receive unconditional love. I think so. We will try to see what we can do. Right now, I think the window might be my volume. on Zoom, and I don't know how to get rid of that. So I see in the chat people are seeing, I think, the box, and it's related to my window. So Sarah, I don't know if we know how to get rid of that, but it's related to like the Zoom controls on my sharing screen, I think.
I did like a quick Google search, and maybe it's like something to do with the optimization settings. Do we have videos to play still? Because if not, maybe we can try to see if we can turn those off, and that would help.
See.
One more video, I think closer to the end, so maybe we can just re-optimize at that point.
I've gotten enough chats about it. I don't want y'all to not be able to see this. So give me a quick second and let me see. Do we know how to not optimize? Now I'm showing that I'm not the person to be. So I may do it during one of our discussions then. So for now, I will try to figure it out. But yeah, I think it's related to the Zoom chat. So I try to keep it in a place. Okay.
And we can send these slides out afterwards. I know we did purposely put the citations on the page for a reason, to give credit where credit is due. And also some of those are linked. So it would link directly to where we pulled the study from, which I think could be helpful. So we will find a way to get these slides so you can both see the citations, but also click the links to go directly to some of the places we got our data from.
And then I think during our next discussion, I'll try to see if I can non-optimize, and but I will try to keep it in a place that is not impacting what you all can see. And just if it is, feel free to flag it again and tell me to move things. So I think the other, in moving forward, when we start to talk about some of the barriers and strategies, I think, you know, in addition to talking about the benefits of animals and pets for individuals, I think also, why does accommodating, you know, emotional support or service animals benefit service providers? Because part of, you know, the work that we'll talk about in working with community partners is really sometimes selling making accommodations if it's maybe not a federally funded shelter. And we'll talk a little bit about some of the nuance around what accommodations need to be made. But I think it increases opportunities for rapport building and engagement with vulnerable populations. You know, as I talked about Kuma being our, you know, 25th member on the outreach team, I think it really did help with engagement, especially with individuals who maybe were more reluctant because they've been out there longer, or they had lots of traumatic events. I think, you know, intuitively they felt a little calmer and able to pet the dog, and it just kind of brought a lot of their defenses down. It also reduces service gaps in the continuum of care. And so you think about low barrier shelter and, you know, HUD's priority for providing low barrier services. Well, a barrier for individuals that have animals is sometimes getting access to those shelters. So in providing accommodations for animals or for emotional support animals, it reduces gaps in that service gaps in the continuum of care. It also allows for more provision of person-centered services. So really meeting the person where they are, meeting what their needs are, and providing services for that individual based on their needs. And it helps us think about policies and procedures to be more inclusive and to reach people we're not previously reaching. So even from an equity standpoint, often, you know, individuals who I've worked with lots of states across the nation, and I think one of the barriers is often, individuals have pets and they can't get into shelter, they can't access services. And so thinking through, how do we be more inclusive and reach people who maybe we weren't previously reaching? And often it has to do with shifting policies and shifting practices within the continuum of care. And so we talked about this a little bit, but wanted to have a little bit more time to see if there are other benefits that you're seeing among your program participants that have pets, or if there's other things that this discussion kind of brought to light for you all. And I know in the video reaction, we talked a lot about some of the things that people are seeing, but are there other things we haven't talked about that you feel like should be taken into consideration when thinking about engaging individuals with pets?
There's one thing I thought of, just like, I think we've already alluded to it, but a companion for clients where like a lot of times they get really lonely and maybe aren't like engaging in other social activities or don't really feel a part of a community. And so having a animal, um, they kind of treat them like their child, like their baby. And so, yeah, I think I've seen a lot of like companionship come from service animals, and like other pets. And I think that contributes to what we were talking about earlier about purpose. But yeah, just wanted to like name that and mention it.
Yeah, I really appreciate you elevating that, because I think that's, part of feeling socially connected, but it's slightly different because it's not feeling alone in the world, right? It's having a companion that can be with you and walk alongside with you, experiencing, what you're experiencing, and having someone with you. I think that's a great thing that we did allude to, but wasn't explicitly stated. So I think it's helpful to say that out loud.
I think one thing I noticed in that vein is a lot of times um, bridging the gap into housing. I think, we are working with people and people want a place to call their own. And at the same time, that transition is way more challenging for people than we kind of give credit for. And a lot of people feel really lonely. And sometimes having someone that can go along with them and be a companion in that situation, in my professional experience, has been really, really helpful. Um, and also, I think, this is a little bit sad to think about, but someone that cares about them. I think there's certainly community in encampments, there's certainly community among people that are unhoused, but unfortunately, the larger community doesn't always treat them well. And there's a lot of bias and stigma. So someone like, I know my dog gives me unconditional positive regard. So the ability to have that when the rest of the world is, though we made progress, still a little bit unkind. I think people have named that to me as something that really is sustaining.
We have cured the box issue. It's optimizing. Sorry, guys. So we will try to keep it that way, and then during the video, I'll do it again. Thank you, guys. But I think 100%. I think some of this is, and a little bit tied to what Teresa was saying. I think there's stigma, and then there's also stigma when you have an animal and you're experiencing homelessness that's on top of that. And I hear questions around ability to care, questions around, and I'm like, let me tell you, some of the people I were working with cared better for their dogs than I've seen anybody care for dogs ever. And so I think, there's the benefits of animals, and then there's also additional stigma that comes with it. And so that's why all of these conversations are so important of, this is actually what that dog is doing. There's a mutually beneficial relationship happening. And I think that's why we spend so much time on that human animal bond, because we all know as service providers, often we're put in a role where we're also the educators, and we don't always want to be, but, community members calling about outreach, people calling and saying, I have a concern about X, Y, and Z. And so sometimes it's that educational piece and saying, actually, research says X, Y, and Z. So I think all of these are definitely important components to think about when we're talking about this pretty complex issue. And so I'm going to pass it to Teresa for the fun definitions portion.
So this might be a little bit dry. I will try to make it not dry. But I think, as Jordan touched upon before, it is important to just know the differences between different types of pets, varying from service animals to just a pet, and everything in between, and kind of what the rights are that are afforded with each different type of category. And also, I think sometimes helpful to know, like, is there specialized training? this, that, or the other thing, because it puts you in a position to maybe advocate in different situations. So next slide. So I think certainly in my experience, I came across emotional support animals and pets probably the most. So this definition is from UMass Medical School. I'm from the Northeast. That's why I kind of lean towards those resources. An emotional support animal is an animal that provides a therapeutic benefit to a person with a mental health or psychiatric disability. It's not a service animal. We'll get into the difference. So there's certain laws that do not apply, but it is also not considered a pet. So it's kind of like somewhere in between. It's providing some support, but it's not providing a service. And is generally not restricted by the type of animal. So different from other categories you'll see, an emotional support animal can really be any animal that can be domesticated. Just as it says right there, any domesticated animal may be considered an ESA. That's why I put a picture of llama and chicks, because I truly have seen emotional support llamas, and I think they are therapeutic. So they're pretty sweet animals. Next slide. So what does an ESA do? And we're kind of going into this in depth because it'll highlight the differences between the categories. So the presence of an ESA relieves symptoms. So just like you heard in the video, that the presence of one of our animals while she's having a panic attack or she's experiencing anxiety alleviates that. She said it kind of brings me back. And usually those symptoms, generally we see it's called emotional support because it's usually a mental health condition rather than a physical condition. And for a person to legally have an emotional support animal, the owner must be considered to have a qualifying mental health or psychiatric disability by a licensed mental health professional. And we'll get into later, like who is covered under that category. I think it's a little broader than we sometimes think. And often that requires, when you're advocating for someone to have access to their emotional support animal in different settings, it usually requires some kind of documentation. Next slide. What is a service animal? We're probably going to spend the least amount of time on this just because there are way less barriers to service animal ownership than the other categories. In fact, in terms of like shelter access and housing access, unless a shelter has no ties to any government entity at all whatsoever, you must accommodate service animals. And it's protected under the Americans with Disabilities Act. So under that act, a service animal is defined as a dog or sometimes a mini horse. Those are the two things, a dog or a mini horse, that has been trained to do work or perform tasks for an individual with a disability. And that disability can be a visible disability, like a physical condition, or invisible. The tasks that animal performs have to be directly related to that disabling condition. Next slide. So some examples are a guide dog for a person who has a visual impairment, a hearing dog for a person who's deaf or hard of hearing, a seizure response dog. I think one of the mental health conditions we see service animals for is sometimes for folks with PTSD who experience like flashbacks or things that take them out of the present moment. And that would be considered like a psychiatric service dog. But again, I think the key point is it has a specific task related to that person's condition. And it's an actual act that it's performing rather than just like the presence, providing comfort like an ESA. Slide. What is a therapy animal? So therapy animals, we had a therapy animal at one of the shelters that I worked at that would come in occasionally. And they generally come with specialized training, but they're really just, their presence is there to have a therapeutic benefit on like a larger number of people across a variety of different conditions, but it doesn't do like a specific task. So it's really like the presence and the calmness of that animal providing the benefit to the person who's receiving that service. Usually, often, therapy animals are brought in after like a traumatic event in a community, and their purpose is really to provide comfort to groups. And they can work in different environments like hospitals, schools, nursing homes. And the person receiving the benefit from the therapy animal does not necessarily have to have any disabling condition. It could just be something awful happened, or something that impacted the community where they could, benefit for some comfort. Next slide. So I already got ahead of myself and got into this a little bit, but they can work with a wide variety of people, generally in healthcare educational settings, but not necessarily limited to that. Some people will bring them to community events if something in the community happened that was tragic. They provide comfort. And the thing to know about therapy animals is there aren't laws at this point in time that protect them. So there's no laws that say you must allow a therapy animal in X location or in housing or in shelter or anything like that. And lastly, what is a pet? I mean, I think we all know what pets are, but just to highlight the differences, they may or may not have therapeutic benefits. I think widely we see through the research that they do, but it's not required to be defined as a pet. Anyone can own a pet. And though I think it's pretty clear that they provide therapeutic benefit to a lot of people, that's not like their job. I included this graphic just for the purpose of, having a consolidated place to kind of look at all the differences and similarities between the different types of animals you might see in your work. So I think what we haven't covered is that some animals require specialized training and some really don't require any specialized training. So service animals and therapy animals usually do come with specialized training, but other categories of animals may not. Service animals and emotional support animals can live in no pet housing. What I mean by that is if there's a no pet policy, ESAs, as long as their documentation and therapy animals have exceptions for that. And Jordan will get a little more into exactly how that's covered under the Fair Housing Act. And only a service animal has like the legal protection to accompany an owner anywhere in public, because they're the only category of animal protected under the ADA. And in the last column, you'll see that both service animals and emotional support animals are protected under the Fair Housing Act, but only service animals are protected under the ADA, and it affords them the most rights. And in terms of advocacy for a person, it's probably the most straightforward. Okay. Navigating the documentation process. So this is a little bit of guidance if you are struggling with kind of navigating how to get something a pet documented as an ESA or service animal. If someone is using an animal in that function but hasn't gone through the documentation process, so it's like a little bit of myth busting, and some of it's really just tips that like a variety of settings have kind of put forth. So one example is HUD has like tips for a letter and the information that should be in that letter to get an exception under the Fair Housing Act. So service animal documentation. Any licensed provider can create or draft a letter. This includes licensed social workers, therapists, and counselors. They must have an established relationship with the person that you're working with. If you have a licensed provider in your agency, what I have done, and I think Jordan has also done this, is if we know someone needs documentation for either a service animal or an emotional support animal, seeing if that person has the flexibility to come and establish a relationship with a person on outreach, because they are going to want you in this documentation to be able to demonstrate that you know this person and you're aware of the role that the animal plays in their life, or how it supports them with their disabling condition. If you don't have that, or if the person in your agency doesn't have the flexibility to say come out on the van or on foot, however you're providing outreach, it can be achieved by telehealth if you were to be the facilitator of those calls in the community. specifically, recently HUD put out guidance saying that that is an acceptable way to get, like, a telehealth provider can provide this documentation. I think certainly with COVID, a lot of therapy is happening via telehealth in general. So I think that has supported that being an acceptable way to build that relationship and be able to speak to the nature of that relationship with their pet or their service animal. And if it's not someone within your agency that can provide the support, kind of explore the person you're working with natural supports. Do they have a physician they have a longstanding relationship that's aware of their ESA, emotional support animal, service animal? And just a tip that online certifications, and this is also coming directly from HUD, I think if you have ever done your own research into how to support your clients with service animal documentation or ESA documentation, the first thing that you'll see is all of these online resources that say, like, we can certify your animal, we can provide the letter for your animal per HUD, and certainly per like the ADA service animal definition. Those types of letters are generally not sufficient. So just to not guide the people you're working with down that path and rather facilitate that real relationship with like a behavioral health provider or a physician. Next slide. Tips for drafting an ESA letter. And again, these came directly from HUD, so I thought I would pass them on because I think a lot of times it's for shelter or for federally funded shelter or for housing. And so why not use the advice from the source to be most effective in your approach? So obviously the person's full name, the person who's writing the letter, what their relationship to that person is. So again, that's the establishment that they have known this person for some time. They're not just writing this letter out of nowhere, and they are understanding of the relationship between that person and the animal. Whether they're treating them for a disabling condition. Some of us might be like, well, obviously, if it's their behavioral health provider, but I think HUD is saying explicitly state that. That will make your pathway to requesting an accommodation or requesting the presence of an emotional support animal more straightforward. And just to note that currently substance use is not a disabling condition per HUD. It doesn't mean that you can't use that to advocate in other settings, but just when we're talking about like federally funded, unfortunately, that is not a qualifying condition. So, kind of exploring maybe what other behavioral health or health conditions they may need support with. They would prefer that you indicate the type of animal and to describe how this person receives support from that animal, whether it's the emotional support, whether we're talking about a service animal where there's a specific task. Outlining all of that, like I said, will make your advocacy efforts for federally funded resources more streamlined, and also contact and licensure information, just easier to verify that that person is a qualified profession to provide this documentation. Next slide. So often what you'll be doing when you're getting this documentation is requesting a reasonable accommodation. So reasonable accommodations are covered under the Americans with Disabilities Act. So this is where it gets a little bit tricky in terms of shelter. So federally funded shelters have to accept reasonable accommodations for service animals, and that's pretty much true of like any setting that you can think of. But for ESAs, federally funded shelters, so I guess you'd have to know a little bit about the funding sources of some of the resources in your community, do have to consider the reasonable accommodation request for an emotional support animal. They don't have to grant it necessarily, but they have to consider that request because it's covered under the Fair Housing Act. Jordan will get into it a little bit more, but there are certain things, reasonable accommodation is because it has to be reasonable. There are certain things that they would consider not reasonable, and then could potentially deny an ESA request. So that's for an emotional support animal, not a service animal. It's recommended that you make your request in writing, and that's both so you can provide adequate information, but also so you can kind of keep track of where that accommodation request goes, and how it's responded to. And you may need proof of a disabling condition. I think, at least in Massachusetts, but I think this is pretty universally true, you don't always have to specify what that disabling condition is. I'm seeing a nod from Jordan, so I think that's universal. You don't have to specify what that disabling condition is, but you need proof of it. And we will get into some different documents that can prove a disabling condition without necessarily saying this is what the condition is, if the person that you're working with does not wish to disclose that.
And I will just add on to that we have sample letters if people are interested and want to do this, because I will say that often in requesting reasonable accommodations, whether for housing or for other purposes, people often disclose more than they need to, which is sometimes, detrimental to the individual that's being served, particularly if maybe you're doing a reasonable accommodation for somebody at the beginning of a housing placement. And maybe I've seen people disclose behavioral health conditions, other things that then later stigma and other things create issues with the landlord. And so if that's of interest, we can definitely supply those, because they're a lot of people disclose more than is actually necessary by law.
Yeah, absolutely. Thank you for adding that. And also, just popping into my head, that's trauma informed, right? We give people the power to decide what about themselves they want to share with other people. So a number of reasons that you may not list the disabling condition, and you don't have to. Next slide. So what documents the disability? And this is where we get into documents that can prove that someone has a disability, but it doesn't necessarily have to say what that disability is if a person does not wish to share that information. So disability determination from a state or federal agency. If someone is receiving SSDI, clearly they've already had a determination made that they have a documented disability. And so all you need is the receipt that they're getting that payment, or SSI for someone who's under 65. You don't need an in-depth copy of their assessment or why they were able to get this funding. You just need to prove that they're getting it. So that's one way to kind of get around that. Eligibility for disability housing. Again, you don't have to give the whole application. You just have to get something that says, hey, they qualify for this housing opportunity. That's clear documentation that they've been determined to have a disability. Veterans disability benefits, services from a vocational rehabilitation agency, or documentation from a healthcare professional in which they can certify and attest to this person has a disabling condition. They don't have to specify what it is. They just have to attest that condition exists. So these are a lot of things that they may have gone through a process already that provided documentation from a physician or backup documentation, but the determination has already been made. And so you just need to say, hey, this determination has been made. And you really don't need to give much more detail than that. Next slide. And I think I'm turning it over to Jordan for fair housing and legal protection.
Sure, unless you want to talk about legal. So some of this is pretty nuanced, which is, I know legal discussion is not always fun, but we feel like it's helpful because it's, obviously in our roles as providers, we're often advocating for individuals. And I will say that often there are violations happening that, people are not aware of. And so we're going to, at a high level, talk a little bit about the different protections, and really part of why service animals tend to get less pushback and less constraints are that they're covered under ADA, as Teresa mentioned. So Americans with Disabilities Act, it covers not only housing, it covers public space, and so it's a broad and more encompassing realm, and also it's been in existence for longer. The Fair Housing Act was modified several times, and more recently included ESAs. But so at a very high level, just talking about kind of fair housing. So Fair Housing Act makes it unlawful for a housing provider to refuse to make accommodations for a person with a disability that may need that accommodation in order to have an opportunity to be to enjoy and use that dwelling as anybody else who does not have a disability would use. And so that's kind of at a very high level what the Fair Housing Act overview is. And so where we see some of this play out is that under Fair Housing Act, most HUD charges of discrimination against a housing provider following a full investigation involve a denial of reasonable accommodation to a person who has a physical or mental disability that the housing provider cannot readily observe. And so for HUD specific housing and for claims that reach the point of HUD investigating it. And, you know, if you're interested, we can talk more about that as well. But a lot of times it's related to reasonable accommodation and denial of reasonable accommodation. And, you know, we'll talk, Teresa alluded a little bit around the process for reasonable accommodation, but reasonable accommodation doesn't have to be in writing. It can be a verbal request. You know, best practice is to have it in writing, as Teresa alluded to, because it's written, you have the documentation, but someone simply saying, oh, you know, this is my companion animal, that's why they're staying with me, under guise of law is considered a request for reasonable accommodation, because the landlord now knows it's a, you know, it's a service or a companion animal and or ESA, emotional support animal, and then it would be an iterative process. So fair housing and reasonable accommodation is kind of an iterative process. But under the Fair Housing Act, a housing provider can't add additional fees for processing a reasonable accommodation request. They can't put limitations on type, breed, or size of the service animal. And they can't charge extra deposits. So even if you're helping someone who is unsheltered and moving into housing, and they're doing the application, and normally the application requires a $50 deposit for an animal, but the person has an emotional support animal or a service animal, they don't have to pay that $50, and the request would be a reasonable accommodation because it's not a pet, it's a service animal or a emotional support animal. And so that extra deposit shouldn't be required because it's considered a support animal, not a pet. And so again, that's part of why we spend some time talking about legal and classifications. And again, if somewhere someone's moving in has restrictions around breed or type or size, that does not apply to a service animal or ESA. And often, I think in the last 10, 15 years, landlords have gotten much better at this, but I think even the education piece around what is and what is not is really helpful. So, you know, our role often as service providers is, you know, the education is power. And so knowing what the individual's rights are to be able to advocate and support is really important in the process. And so that's why we spend a little bit of time just talking about fair housing and what applies. And so under the Fair Housing Act, a resident may request accommodation, as I said earlier, at any time. So I've had individuals that were in the process of getting evicted and request reasonable accommodation during the eviction process. They can request pre-application, post-application, ongoing tenancy at any time. And I think that is something that people often don't know, and even the reasonable accommodation request during an eviction process slows down the eviction. And so even using that as an intervention to support the individual and not becoming homeless again. And so the provider must consider the reasonable accommodation regardless of the time that it's made. And then there's an iterative process around what can happen and what can't happen. And so, you know, what accommodation can be made under the current structure of the program, and what is actual an accommodation. And often with ESAs, it's a little bit more straightforward because it's, you know, this particular establishment doesn't allow pets and this is my ESA, and so I want an accommodation. So some of them are not as nuanced as other reasonable accommodations in other realms, but just knowing that you can request a reasonable accommodation is helpful. So there are some limitations on the Fair Housing Act, and why it applies across the board to most affordable housing. There are a few exemptions on the housing spectrum related to, like, if it's a single family home with bedrooms, things like that. And so there's exemptions within that, but it broadly encompasses most public and private housing. As it relates to shelters, it only applies to federally funded shelters. So excuse me, shelters that are not federally funded are not legally obligated to consider reasonable accommodation requests for ESAs. And this is where some of the tension plays out in the work that we do is, you know, when I was overseeing programs in DC, they were city funded. And so they were not required, they were only required to take service animals. And so it was advocating on a broader level, or some of the other strategies that we're going to talk about forming partnerships with some of the animal shelters and things like that. So it's just knowing how shelters are funded can help with advocacy, because there are, in my work, we've encountered shelters that were federally funded that were not considering the reasonable accommodation request right off the bat. And technically that's a violation. And so at a broader level, having that conversation. And then also when considering emotional support animals or even service animals, looking at if the animal poses a threat to people or property, then it can be denied. So if the animal is aggressive, if they have a history of biting individuals, like when they're looking at reasonable accommodation request, or even, you know, a shelter that does take pets, sometimes they'll consider other aspects around if the pet is aggressive, if there are issues causing damage to the property, causing damage or threats to others. So particularly from a shelter's perspective, sometimes they're balancing their whole operations and everyone within it with a specific request. And then, as we've talked about before, there are no protections just for pets. And so that's often where we find a lot of struggle across different states, is for people who maybe have pets that are not emotional support animals, and they still have that same, all the stuff we talked about around the benefits for the human animal bond, and the person doesn't want to leave that person or that pet, or have that pet stay in an animal shelter while they're in a shelter. And so a lot of times that's where we find people staying outside unsheltered, because they can't seek shelter just because they don't have they have a pet and there's not a shelter in their area that will allow a pet. And so I'm curious, I know we talked about some of the benefits of pets. I know you guys are kind of living and breathing this work. And so just wanted to talk through some of the challenges that you're seeing in trying to link individuals with pets, regardless of the status of pets, you know, service animal, ESA, I think there are challenges across, but in your work, what are some of the challenges you're seeing, and what really drew you to, like, yes, I want to go to this training and talk about it? And feel free to drop in the chat or come off mute. Or if you guys haven't figured out, tell us. I do think this is one of the harder challenges. So just thinking through some of the challenges, maybe we've already talked about them, that you have in navigating linking individuals to services or housing when they have pets.
I think we have people from different places on this training. Are you generally finding that shelters in your area are accepting of pets? Because I think we went over like what shelters with different funding sources are required to do, but they can also make, if they don't have federal funding, they can make different choices. So I know there's variety in that. So I'm just curious what people's experiences are where they're providing services. I know like my shelter system, we advocated pretty broadly to have people be able to have their pets with them, or ESAs, but it was kind of like a organizational level decision, and not every other shelter, like say, like our Salvation Army shelter was privately funded. That particular one didn't have that accommodation. So I'm wondering kind of like what the landscape looks like.
I can speak a little bit to that. I work in like the Santa Barbara area in California. Um, and I don't know about like all of the shelters in the area. We have quite a few. But I do know that like a somewhat recent development on this front was a domestic violence shelter that um like recently added pet and like emotional support animals like resources to what they were providing, because I mean like we've talked about in this training, they found that like a lot of individuals they were trying to serve like wouldn't come to their shelter because they weren't allowed to bring their pet. They didn't want to like leave them, or there weren't like any other places for them to go. And so, yeah, like that's definitely been a conversation of like trying to figure out how to reduce that barrier for people.
Yeah, absolutely. And I feel like it's been more recent that there's a push to reduce barriers more universally. And one of those, the benefits of that is there has been more like nationwide advocacy for co-sheltering, meaning like sheltering with your pet, and like how do you adapt your program so that that works with the entire milieu of people. So yeah, it's encouraging that more places are kind of adding that to their services.
My name's Ellie and I'm a case manager in the same organization as Jordan. And I think the biggest barrier right now, it's not so much the reasonable accommodation, because I managed to get that if I try really hard. It usually works out and most providers are pretty willing. So that is really rewarding, but it's more like the financial aspect of maintaining that. Like I have a client that just moved into housing and he just can't afford to groom his dog, you know? And so like his dog does smell. I did have to say something, you know, and like trying to find resources for this particular demographic where that is free or highly discounted has been hard, you know, transition to housing. Or like to get them into certain housing, they'll allow the animal, but then there's you know, proof of registration with the county or with the city, and then there's another fee attached to that, and then it's a higher fee if the dog isn't spayed or neutered. And I find that for some reason a lot of my clients have like a strong principle of not getting their dog fixed. I don't know why. They're like very attached to not doing that to their animal. So that does usually bring higher fees into play. So just kind of the financial aspect.
Yeah, and I think that's the thing that when people talk about, they don't think about the other side of like when people are in housing. And so, you know, we had this issue with a lot of people when I was overseeing a PSH program. And so there were a couple grants that we applied for that were through partnership with like the SPCA or the local shelter. And then I feel like I've advertised this a lot recently, so we'll see if they still do it. But we also reached out to Chewy, and Chewy often, like, which is the food, they're super pet friendly, but they often take food back when people are like, oh, it doesn't work for my dog, or and then usually they donate it to local shelters. And so we were like, hey, do you happen to have any of that food or any of these supplies that, and for it was, you know, a fair amount they would donate to us because we told them this is what we're doing. And so we kind of led through other entities that were maybe non-traditional partners, because, and obviously that's like a short-term plan, and then the long-term plan is looking around like sustainability for budgeting and employment and all the other things that come with that, because which so I think some of that we'll probably talk through some of the other strategies too, is just leveraging partners sometimes. But I think it's definitely hard because, and if you're the person's on the street, vet care, and how do you get that? And so there's started to be more mobile vets and things like that that come out to people and will engage. So I think that's definitely a pretty hard challenge to navigate for sure.
Yeah, I think those resources are expensive for people that aren't recently housed and don't have a history of homelessness. I know they're expensive for me. So I think, yeah, you really have to be creative. And we'll talk about this like a little bit more, but really kind of look outside the traditional resources to say, like, what are different partnerships I can form? What are places I didn't really think to try, and worth throwing my hat out there and seeing if there's something, someone can do to support this thing that we're seeing. Yeah, it's really hard. It's really hard. And the people that have the pets, they want to take good care of them, but there are so many challenges and expenses related. Grooming's a really good example.
Any other thoughts or challenges that we haven't talked about? I think Ellie brought up a really good one, which is the grooming and the unintended expenses that are apparent in there. But any other things that we haven't talked about? I will say California, as far as ESA, has additional protections at a state level in addition to the federal. And so I think they're definitely one of the most progressive states when it comes to like animals, particularly emotional support animals. So it's exciting to hear that you were like, oh, I don't really have problems with the reasonable accommodation piece. But here's the other challenges, right? Perfect. Well, as we move through, feel free to kind of like raise your hand, drop things in the chat if you think of additional things that we haven't covered. We'll definitely have some time for discussion too. I'm going to turn it back to Teresa.
Okay, so this is, the discussion is kind of leading into the next section, which is like, what are some of those challenges? What are some ways that different organizations have created partnerships or worked around these challenges? Some of these maybe you've tried, but hopefully there are some things that you haven't thought of that we can give you as kind of a starting point today. Next slide. So just a little bit, and I'm pretty confident that the people in this room and doing this work are probably very familiar with what the barriers are. But in a 2021 survey, nearly half of the pet owners that were living unsheltered, so people not accessing any type of shelter program in LA, report that they'd been turned away from emergency shelter, and that the reason for that was policies about whether or not they allow pets. So I think a few things usually are going on there. Sometimes even federally funded shelters have an overarching like no pet policy or no ESA policy, and you have to take a few extra steps or like jump through extra hoops to get support animal approved to go into the shelter. So when they first come to the door, the automatic response is kind of like no, or maybe, but you have to do X, Y, and Z. And just thinking about what a challenging and discouraging experience that could be if your day-to-day life is already challenging, and if you're already having to worry about where are you going to sleep that night, where are you going to get a meal, having to think about going through a process to just get somewhere to have a roof over your head is pretty tough. So I think that's where the folks on this training come in, and where you can really lend your support. In the same survey, individuals pretty clearly stated that they felt like they had to choose between their pets and the services they need. And that didn't just include shelter, that also sometimes included healthcare services. So like Jordan said, though the motivator to get some healthcare might be to stick around for your pet, if there aren't resources for someone to take care of your pet, if you don't have someone in your encampment that you trust, if you aren't able to afford boarding or you have nowhere that offers that for a low cost, you may not be able to attend your health appointment. I know in one of the shelters that I used to run, we had a crate because we had a healthcare for the homeless clinic co-located in that shelter. So we would say we will do pretty much whatever to get you to your health appointment, including if you're willing to crate your dog for that time, they can sit in my office while I do my paperwork, and you can go to see the clinician that day. But not everywhere is willing to do that, or maybe they just haven't thought of that. And I think that's another place where you can come in, is you can be the person that's bringing those ideas forward. And just generally, we already know this. People, when they are forced to make that choice, will generally choose to stay outside with their pet. Like we've touched on already, increased fees. People may try to impose them, even if it is an emotional support animal. So knowing your rights is really important. But certainly, if it's just someone's pet, the reality is there are increased fees when you're trying to move into housing. And how do you navigate that? Also, some shelters that do accept pets request veterinary records. And I think there's valid reasons, valid public health reasons for that. But I think also trying to imagine what it might be like to try to keep paperwork. I know that sometimes I struggle to keep paperwork. So if you could imagine not having a stable place to be, how tough that could be. And so that can be a barrier to even accessing the shelters that say, yes, we are able to accommodate pets here. And another place for you as potential, like I know some of you are outreach workers, if you are working with someone who is pursuing a pet-friendly shelter, is there a way you can scan in their documentation? I don't know. That's just something that normally we wouldn't think of in our service delivery, but is a real barrier to getting a roof over people's heads. Cost of veterinary care. Ellie, you really spoke to this. It's not just veterinary care, it's grooming. It's wanting to provide them with like toys, treats, like all the things you want to do for your pet, but also thinking about things like boarding. So if you really, really bad weather, you wanted to go into the shelter for the night, boarding is expensive. What are you going to do with your pet? And are there low cost options for that? And lastly, one of the reasons I chose to put that first video in this presentation was to really highlight and myth bust around, although it doesn't seem like I had to do that with this group, myth bust around the stigma that people experience in like sometimes outright harassment, comments that are nasty, because people think that if you're homeless and you have a pet, you're not taking care of that pet. And I think we all know pretty clearly, and the video demonstrated that that is definitely not inherently true. And there are many people that I worked with that would feed their pet before they fed themselves. So I just think that speaks to the strength of that relationship. Next slide. So I think we have to optimize sound again. So I'll let Jordan do that and play another video.
My name is Bridget M. Smith. I am downtown on Skid Row. This is my service girl, Nubian. She has me because I have issues. I hate to say it, downtown. It's the only place you can come and get some assistance once you've been put in a position when you become homeless. 13 years ago, I lost my son. I went to counseling and she told me it was more than that. I need to go to the mental hospital. And that's when I was diagnosed with my situation. And that was my first round of being homeless. 2 years ago, a good friend of mine, she goes, look, girl, you know you're crazy, you have anxieties, whatever. She goes, I have a gift for you. Because she'll keep you calm. She'll help you more than anybody else can help you because she's yours. I was hesitant because I didn't want an animal because that's a responsibility. But once I got a hold of Nubian, I won't trade her for the world. She makes me feel like I have a reason to be here. She's like my child. I mean, I do without to make sure she has it. One place said they couldn't take her, and I'm like, yes, you can. If Nubian can't go, I can't go. It's just that simple. Would you leave your child outside and you go inside? My child would go inside before I do. And she's a service animal, but some people still don't like to recognize that. I have a depression problem, yeah, and I have some anxiety problems, but overall, I can't make it on my own. It's hard because you have to show documents of whatever your situation is, and if you don't have it, you don't get no assistance. I signed up for my Section 8 housing, and yesterday I got my voucher. I was really crying, and I went and hugged her. She goes, what are you trying to do? I said, I want you to cry with me because you are giving me this chance to start my life over again. I am loving my new place with me and Nubian. We have our privacy. We don't have to stress about where we're going to be at the next day. We know we're here. I'm not a druggie. I'm not an alcoholic. I had something that happened to me traumatic in my life that took me to the point of being homeless. And I admitted it and went out for help. I'm a person. I come a long ways in 9 years. Less is more to me. This is the way I choose to live my new life. I have just the necessaries that you need. I used to think I needed to have all that materialized things, and it's not important. I got my girl. We get to go for our walks and we eat. That's it. You know, I don't need all that stuff anymore.
Sorry if everyone has tears again. But I think the reason I put that video in is it demonstrates the whole picture from A to Z, everything we've been talking about today. So, one, the purpose and how beneficial pets can be. Two, the barriers. You heard her. That's a service animal, and she's still running into challenges. And I think that's very real. I think the person at the front door of the shelter doesn't always know the entire process. And sometimes the role that we take is educating them about that process and also kind of like partnering with people to encourage them to go through that process when it's just like another thing. You heard her say it's hard for me to keep paperwork. Again, a very real challenge. And like, how do we support people unfortunately having to jump through the hoops that they have to jump through to improve their situation and be able to take like their best friend with them. So I don't know if anyone had reactions like Ida did to that video. I've watched it a few times, so I don't get choked up anymore, but certainly the first time I saw it, I did. I think it's just such a beautiful story about how when you're able to maintain that human animal bond throughout your process, how beneficial it can really be, but also being real about how hard that can be. Video. Yeah, I love that one. And that organization, I think I linked them at the end, but that organization does nationwide advocacy about co-sheltering. So I think it's called the Co-Sheltering Collaborative. Really working with shelters that want it to provide TA, but also just advocacy for policy change around why we should be approaching things from recovery oriented lens and allowing people to stay with the animals that mean so much to them. So that being said, what can we do to help pets and people and ESA owners? So I think there's a range of ways to look at this, and talking about the co-sheltering collaborative makes me think of advocacy. So what's the thing that helps us support our advocacy? That's data. So collecting the data about people who are living outside with their pets. So I think in Cambridge, one of the places that I worked, one of the things we did was work with our HMIS lead for that continuum of care to build in a way to capture that. It's not always automatically built in, and it probably depends on the homeless management information systems that you have. But often people don't think like, often people focus on what's required by HUD because that's who's driving the data collection, but there sometimes are options to collect data beyond that. So maybe it's connecting with your local COC, finding out who your HMIS lead is, and seeing what the options might be. They might be very open to a discussion about collecting additional data for your program, if that's something that your program wants. Again, related to the COC and just making sure everyone knows what COC on this call is, continuum of care. So that's like a network of services and housing providers that support people that are homeless in your community. Advocating with them to support policy change. Again, I think there's the federal protections, but there's also choice at county, city, and individual program levels. So, for example, Jordan mentioned that he operated a shelter at the city that was fully city funded, and they said, we aren't going to allow pets. I operated a shelter in a different city, and they said, absolutely, we're going to allow pets. And we're also going to give you funding for resources to make that happen in a way that's safe for people. So that's just to demonstrate that there's choice. I mean, sometimes you can have a role in how those choices are made by bringing these issues forward. I think there's so many competing needs when we're talking about people that are homeless. People aren't always thinking about the relationships people have with their pets or realizing that that's keeping them from accessing services. And so really drawing that out for them to advocate for policy change. Advocating for the development of low threshold programming. So that is, I think, a growing trend. And at the same time, low threshold programs are really aimed at reducing barriers. So if having a pet or an ESA is a barrier, often they will think of creative ways to address that. And I think also there's an opportunity if you know there's being a low threshold space stood up, if a new one is like coming online in your community, to kind of talk about what's needed in the community, and advocate for that to be part of their policy development. As an agency applying for small grants, I think Jordan mentioned Chewy, but Petco has a foundation, and a number of other organizations like that do have their own foundations that support different needs. They might not be towards individuals, but maybe it would be towards a provider, and you can you can apply as an agency to PetSmart, Jordan also mentioned. So yeah, a lot of those have varying philanthropic efforts, and sometimes we'll either have a process generally or put out processes to like request funding to support like pet food, pet supplies. I don't think we were awarded it, but at one point we had applied for funding to get funding for boarding specifically because we knew that that was keeping people from going to outside appointments, or for coming in for a few nights during the cold weather, which is severe in New England. And lastly, find out what food banks in your area stock pet food. And some animal shelters, whether like city or not for profit, also have kind of like pet food banks, but some just regular old food banks also stock pet food. So something to look into if it's not something that you've explored before. And that can be part of what Jordan was mentioning about like sustaining someone. If someone's regularly going to a food bank, is there one in the community that also provides this resource? Next slide. Partnering with animal welfare agencies. I think one way that you can build a partnership is talk about kind of like what the overlapping priorities are. So from our perspective, the benefit is maybe we can work with animal welfare agencies, like I said, for resources around food. Sometimes they have low-cost veterinary clinics or they're connected to low-cost veterinary resources. Sometimes different veterinary providers will partner in a philanthropic way with animal shelters overall to provide low-cost resources. So they may be able to help you establish a connection with someone like that in your community. They can provide education about like what might be needed if you wanted to set up a co-sheltering space in a shelter. What are some of the things you could consider in your program design? And I think the overlapping priority is what happens is when you partner and you get these resources online for people, they're more likely to be able to maintain their pet ownership. They're not going to be in a position where they can't get inside and they need to consider giving up their pet, or they get into that unfortunate situation where maybe they can't afford to take care of them, and they make that decision. So there's less pets surrendered to those animal welfare agencies. And that's kind of what I meant by the overlap in benefit when you're establishing these partnerships. So there's a number of things they may be able to provide or connect you to. And then they benefit as well because it's the facilitation of keeping an animal with their owner. And we all know animal shelters are overcrowded. There's more need. I mean, yeah, there's more need than there is space. And so that kind of helps alleviate that if people are able to keep their pets, either whether they're unsheltered, in shelters, or newly in housing.
And I'll just add, I think having these standing relationships help in harm reduction too. So I'm thinking, winter seems to be a thing for us East Coasters, but we had like an emergency shelter and we had a standing relationship with the animal welfare agency or the shelter, and they usually would board animals for a certain fee, and we got them to waive the fee and helped us get people to go into hypothermia shelters just for the night because it happened to be 8 degrees, and like there's so many safety factors there. And so we had that standing relationship, and so they waived fees and we were able to get 50 people to go inside because their animals were housed, and then they could pick them up at the next day or whenever the cold snap was over without having to pay a fee. And part of that was, I think, just because we had the standing relationship, working with them, and also just advertising. Some of our work is advertising things as mutually beneficial. And I think animal welfare agencies don't want, Teresa alluded to, you don't want pets in the situation. And so how do we prevent that? We prevent that by supporting owners that have pets and really taking care of their pets. And so I think, through that collaboration, we were able to have some like stopgap harm reduction approaches, particularly for our residents that were living in encampments that during times when it was unsafe.
And I actually just realized I skipped off one of the most important partnerships, which I think, surprisingly to me anyways, one thing that we did with the low threshold shelter that accepted pets, is that we did have, I think it was definitely few and far in between, but it happened. We had some pets who were not so great with other pets, or they didn't have the safest behaviors. The person just didn't have the time or resources to put into like really comprehensive training. So we outreached some local trainers, and the response, and this depends on who you're outreaching, and you may have to outreach like 100 independent people before you like get that person. But I think I was surprised by the response in that people were willing to donate their time. And we had at least 2 success stories. And there, I think, really were only 2 cases. There were 2 success stories where we were able to work with someone and they were offering their services for free because they just care about animals. Where we were able to turn some behavior around or work on like crate training or work on leash reactivity, so that pet was able to come into the shelter. So that's another kind of like out of the box thing that you might not traditionally think of as a partnership, and a really nice experience that people that care about animals really tend to care for the greater good of animals and may be willing to be a resource for you to call on occasionally. Next slide. Navigating the shelter system. So I think this is really about knowing the resources in your community. So we talked before about how discouraging it might be if someone who's living outside finally makes that decision to go inside, and they are met with a process or a denial at the door. So potential role for folks on this training is to either know ahead of time or call ahead of time with that person to inquire about their policies. Is there any process we should go through up front? This person's thinking about coming inside. Or some places are actually open to pets, or like what do I need for that person to come in with their pet? So is it that they need verification of vaccination? Can we help them contact whoever provided that to get that? My team bought crates at times if the policy was, yeah, I'll let you in. It's really, really cold, but the animal needs to be crated. I know we're all operating on shoestring budgets sometimes, and sometimes those crates are only like 30 bucks. And sometimes people have them on like Facebook Marketplace. That's kind of like getting way out of our scope, but it is a solution. If you could find a free crate and you think that that's going to get someone to the shelter, then like, let's do it. Like, let's do it. I think in general, when you're looking around for resources in your community, places that say they're low barrier tend to have more flexible policies. And additionally, if a place is marketing itself as non-congregate, meaning that there's either one person to a room or 1 to 2 people to a room, and a pet could potentially remain in more of a like not isolated, or maybe isolated is the right word, but like not thinking of that negatively, but in a set aside space, there may be more flexibility. Those are just kind of like general guidelines. I can't speak to the specifics of every shelter, but that's typically what we found. And asking whether ESAs are considered when asking for accommodations. Like I said, different shelters have different funders and different requirements about how they respond to these requests. They may or may not have applicable law under Fair Housing Act. So knowing that up front just helps avoid, I think, frustration when people are looking for resources and that experience of being turned away potentially at the door. And the last one I got ahead of myself and already covered, but like, what are the out of the box things that we can do? Would they consider if we kept the animal crated? Can we provide the crate? Things like that, leashes, all those things. Next slide. And lastly, let's talk about some examples. So these are a few that were lifted up through either out the literature or by that co-sheltering initiative as places that really have a comprehensive approach to allowing pets. So Catholic Charities Santa Rosa, they kind of did what we discussed, which was collect the data and notice a trend that people with pets would not come into their shelter or shelter in general. They use their outreach team to go to those people and let them know, hey, we're accepting pets now. And this is the policy, like this is what you might need. So again, they avoid that frustrating experience and are aware of kind of like what the steps are. They currently are accepting dogs without any size or breed restrictions. The only time they may not accept someone is if there's a behavioral issue that jeopardizes the community. They do need to have the basic vaccines or be spayed and neutered. So that's something that I think even like we talked about, places with flexible pet policies may ask for that. And they actually provide the crates and kennels. And there's a specific area that's kind of set aside for folks who have pets. In that way, you know, certainly there are people with pet allergies, and you want to think about the space design to keep that separate. Next slide. Interfaith Hospitality Network in Cincinnati. So this isn't an example of a shelter, but it's kind of an example of a partnership or a community resource. So they provide kennel services or boarding services. They provide free vaccines and pet supplies, free or inexpensive spay and neuter programs. The behavioral training, which is like a bigger piece than we think of, is something that they're able to do. I think they said upon request. And they work with people that are already homeless, but also people that are at risk of homelessness. So if the expenses related to someone's pet are jeopardizing like their ability to pay rent, which I think Ellie talked about in her example, what resources can they offer so that this is actually like a prevention resource? So if that person's like, I'm not going to not care for my pet and it's putting them in a jeopardizing situation, how do they address that up front so it's no longer a challenge? Next slide. And the LA Homeless Service Authority is currently, this is from the Co-Sheltering Initiative also, they are collecting information about the needs of people in their community that have pets and aren't accessing shelter. They provide training for service providers, and service providers primarily means like outreach and shelter providers, about what things they can think about or policy changes they might undergo to make their environment accepting of pets or make that a workable solution in their setting. And they currently are providing funding for that. I'm not sure what the grant cycle is, but just to know that that's something that's available is something I think that's pretty innovative, and it says like, hey, we recognize that this is an issue and we want to be part of the solution. Next slide. I think I already touched on this one. I think I've raised them up several times, but it's a nationally policy reform organization that I definitely recommend checking out. They are kind of like a center of excellence model. They lift up best practices across the country. I think more than I put in the slides here, there are many other examples of innovative things people are doing in other states that you could look at and see if it's something that you can replicate in your community. And that's everything from providing resources to like, if you were to build a new shelter, how would you make that pet friendly? So just another resource to draw from that's doing some national advocacy. Next slide. And lastly, we have about 12 minutes left. We do have, I think, a few polling questions at the end. But we wanted to just leave room for some discussion. We've talked a little bit about what people's experiences are. We're definitely curious in your communities if you have had any successes with collaborating with shelters, advocating within your system, collaborating with welfare agencies, kind of facilitate a discussion for everyone to learn from each other, just because I think there's such great variation at this point in time, since there's not really standard national policy about what is possible. So, what has worked for you when you're trying to address this challenge? Or maybe even if things haven't worked yet, are there things that you're trying to do for your folks that are trying to access shelter with pets or ESAs?
Or there's still like outstanding things that you feel like, I know we've talked a little bit about some of them, but things that are still challenging to you. Because I think, with ESAs, it's access to shelter or housing, but sometimes when we're doing outreach into encampments, the goals isn't necessarily getting them into shelter, it's sustainability, it's connecting to long-term housing. And so just curious if there are things from this presentation that stand out to you, or things that you're already using or will use moving forward.
Hi, I can speak to just like some of the collaboration that I've seen. There's a couple of different animal welfare agencies in Santa Barbara that like our program has had a lot of success in coordinating with and getting like health services for animals, or like spayed and neutered services. And then also like other agencies that will help pay for licenses for animals. So yeah, I would say that it doesn't always work out exactly like we want it to, but there's definitely organizations that I've found are willing to collaborate and try and provide that for our clients. So
yeah, and I think you're right. It doesn't always work out, but it's kind of trying everything in our arsenal, so to speak, right? And sometimes it's really the success and partnerships that really work out.
Just touching on some of what Jordan was saying, I know there's like a mobile vet kind of vehicle that parks, I think like once a week or once every other week. And usually the clients know a lot more about that service than I do. They're the ones to tell me about it. And then there's also like a free like pet food giveaway that happens at the park every other week, I believe, or every Thursday morning. And they're also the ones to tell me about that. And something I do when I know a client is looking for housing and they have like that assistance animal, I try to get to know, like I try to get a list of the providers they're already working with, like their PCP, maybe a therapist. That way, when we do get to that point where I anticipate a letter, you know, it's a lot easier and it doesn't feel like we're just going to the provider just for that. You know, there's already a history of engagement, so it makes it a much smoother transition.
Yeah, which I think is great. It's that trauma-informed approach of like, where are we heading and how can I streamline the process so that it doesn't create additional barriers and additional hoops, so to speak, to jump through. I think that's a great strategy. Any other thoughts? Or I think, you know, obviously I can see why some of you signed up for this because you have a lot of people that you're working with are navigating some of that, but just curious if, you know, there were things that you hope to talk about that we haven't covered, or if you feel like this is in line with kind of the things you're seeing. I'll tell you, you are in good company. There are a lot of communities that are really trying to navigate some of this. And to Teresa's point, there's been a lot of movement and a lot of progress. And I will say that, you know, California tends to be progressive in their thinking around some of these. So it's good to hear some of these success stories for sure. Well, Teresa and I will stay on if there are any questions or any particular scenarios you wanted to talk through. We really appreciate it. We know it's a smaller group, so we thank all the brave people who are willing to come off mute and chat with us. Definitely makes it a little bit more fun for us, but there's a couple polling questions that I think Sarah's going to bring up, but feel free to let us know if there are any other questions or things you think would be helpful. You have time to complete those, but let us know if there are any final burning thoughts or questions. We'll stay on, and if not, thank you all. I know this was a long training to sit through, so we really appreciate kind of your participation and engagement. It's definitely a place where there's opportunity for improvement and coordination.